plate, so we appreciate you taking the time out to be, and I'll let you take it away.
Good morning, Angela. How are you doing this morning?
I am wonderful. Thank you, sir.
It is my pleasure to have the opportunity to speak a few minutes here with the Lexington Chamber. Like to say, first of all, I'm a proud resident of Lexington myself. My wife and my 5 children have been residents there for over 30 years. I did grow up though on the other side of the dam. I guess I was a transplant into Lexington by way of Irmo, but 30 plus years now in the Lexington community. Odie, congratulations to you. Odie and I go back a long way. My boys played ball some with his son years ago. They didn't quite excel quite as far as Aaron did though with baseball and with other sports, but it was certainly a pleasure spending time on the field and around Odie growing up over the years with our kids. But it is great to have the opportunity to speak with you a little bit this morning and talk to you about your National Guard, our National Guard. And I say that because we are a community-based organization. We have personnel from all 46 counties in South Carolina. We have facilities in just about every one, about 41 of those counties. But we have our soldiers and airmen that live in the communities, serve in the communities, and then respond to situations such as where we are today with COVID-19, and do so with a lot of zeal and a lot of excitement. I've had an opportunity now for over 30 years to be a part of the South Carolina National Guard. I started my career on active duty and had an opportunity to come back to South Carolina, where I served with the South Carolina Department of Natural Resources and was a wildlife officer for over 24 years. And I'm one of those people that I can honestly say and fortunate to say that I enjoyed my career each and every day, never dreaded going to work. And likewise, now as a member of the National Guard, I also say that with a lot of degree of excitement also. But it is interesting times that we're in today. For the last 100 plus days, the South Carolina National Guard has had soldiers on duty responding to the needs here in the state of South Carolina. And we have also had soldiers to respond to needs outside the state of South Carolina. We are a very diverse organization, not only in our makeup, but we also are very diverse right now in the missions that we're performing. Since 9/11, the National Guard has been highly deployed to include the South Carolina National Guard, both the Army and the Air National Guard. And to date, we've had over 25,000 soldiers and airmen who have been deployed in support of the war fight, primarily either in Afghanistan or Iraq. And today we have soldiers who are currently deployed in support of the war fight. And we're doing that at the same time that we're responding to the COVID pandemic here in South Carolina, and which certainly has had effects throughout the nation and throughout the world, and has been a challenge to our ability to manage and provide adequate health care. And it's also been a tremendous challenge to our economy. And certainly as a member of the public sector, I am fortunate at this moment not to have to be so worried about where my next paycheck comes from, and I'm grateful for that. But as members of the private sector, which most of our members of our Chamber of Commerce are, my thoughts and prayers go out to all of you who run businesses, certainly those who are struggling at this point in time to be able to maintain your businesses, take care of your employees, and to provide vital services to our local community. So I hope that you are all doing well, at least from a health standpoint, and maybe in the near future, we can all see a strong economic recovery. And we have certainly seen that in the Lexington area over the last few years. Again, growing up in Lexington, I've seen it go from what I thought was a small, little sleepy little bedroom town to now a robust community that provides a great quality of life for many of us who call ourselves residents of Lexington. But I want to talk a little bit about our National Guard. Our Army National Guard has about 9,300 soldiers. Our Air National Guard has about 1,250. And we also have, as Odie spoke of, a very robust group that are volunteers, and that is our South Carolina State Guard. We have approximately 750 members of our South Carolina State Guard that generously give of their time and talent to support operations, whether it's in support of hurricane response or, as we've seen here over the last few months, in support of the COVID operations. I want to focus my comments primarily, though, on our support to the COVID mission that we're a part of right now, and try to talk a little bit about the challenges that we see there from a military perspective, and then also want to talk to a little bit about how I see the Guard being able to continue to support in this manner. The Secretary of Defense, Mark Esper, early on in the operation gave the adjutant generals and all of the DoD network some driving guidance to help us formulate our plans. And his priority was, first of all, take care of our force, take care of our soldiers, sailors, airmen, Marines, and those family members that support us. Our second responsibility was to maintain our capability to perform missions. As I noted earlier, we are currently supporting the warfight, and that has to be a significant priority that we keep an eye on to ensure that we're able and in ability to continue to provide that type of support. But the third was to be able to support in a whole governmental, holistic standpoint the current pandemic that we're facing with the COVID crisis. And to that degree, the South Carolina National Guard and the National Guard, I'd like to clarify this, is a unique organization. The Department of the Army is comprised of 3 different elements. That is our active Army, again, which I started my career as I commissioned out of the Citadel as an active duty soldier. But then we have the Army Reserve, and then we have the National Guard. Each state, along with the 3 territories and the District of Columbia, all have National Guards. Excuse me. The National Guard is about a 350,000 person organization. And the unique, I guess you would say, feature of the Guard is that we have a capacity, unlike our active counterparts in our Army Reserve and other branch reserve counterparts, is that we have dual missions. We are authorized by law to perform both state and federal missions. When we're performing a federal mission in support of the warfight, we would be, excuse me, on Title 10 orders. In our normal day-to-day operations, we're in what we are called Title 32 soldiers. And unlike an active duty officer, when I take an oath to support and defend the Constitution of both the United States and of the state of South Carolina. And I take an oath that I will obey the orders of the President of the United States and of the Governor of South Carolina. And that oath is similar to all the oath that our soldiers and airmen take, regardless of what state they're from. But it does give us some unique flexibility, both at the state and federal level, to perform missions that our active soldiers cannot perform. And I'll talk a little bit more about that in a few minutes. But when we first started in the COVID environment, in what we call our DSCA, the Defense Support of Civilian Authorities role, the National Guard is always in a support role. In the traditional response that we may have in a hurricane is we may support SLED, State Law Enforcement Division, or the Department of Public Safety in a law enforcement or traffic management issue. That may be one of the examples that we would be. We may support the Department of Transportation, where we help support traffic control or traffic checkpoints, i.e. when we reverse I-26 or other major corridors in the state, the National Guard, along with others, are out there helping to implement that traffic flow. So those are missions that we may perform. In addition, we have engineers that may go in right after the storm and help clear debris to allow for life support type entities to get back into the communities, your firefighters, your police, and be able to get into the healthcare systems. Throughout, though, we provide a variety of other missions, and those are, again, all in support of some state agency that has the primary responsibility for those missions. In the COVID situation, Department of Health and Environmental Control, DHEC, and when they are mobilized in support of the COVID fight, one of the first things that we did was go to our plan, and we do have a state plan that addresses pandemic type situations, and look to see, how do we fight this? How do we fight it from a plan standpoint? And every plan that you have, and some of you may have a military background, is a start point, but it's certainly like anything else. It's not going to always go to what your plan has described. And we have, we found over the last 3 months that some of what we had planned has worked quite well. Other challenges that we have found, the plan that we had put together may not have worked quite so well. But I think that you find success, and you would say probably in the same capacity as a business owner, it's not how you maybe go into a crisis or a situation with a plan, but it's how you come out. That means you have to be able to adjust. You have to be flexible. And our leadership in the National Guard, along with the state leadership, has had to be creative in some situations, had to look at the situation and find solutions that would allow us to accomplish what our needs and our objectives were, but be able to balance other priorities also. We're struggling now as a nation and as a state to balance an economic recovery with maybe control of the pandemic by the social closure issue and wearing a mask. And had an opportunity yesterday to go out into the local community there in Lexington. And I did see that most of our community residents are adhering to the guidance given by local officials and the recommendations by the governor, and to wear masks and to social distance. And that type of, I think, adjustment, that type of change, and is the kind of approach that we've got to have for us to be successful in this. It will take all of us doing something that will help work through these complex challenges that we have. I'm going to share a little bit of information about where we currently are today, and this was information as of yesterday, but it is pretty accurate. When DHEC reported yesterday, we had 56,485 positive cases of COVID, which was a 1,950 increase from the day before. So if you look at that trend, as we have seen continually go up now over the last several weeks, I would say that somewhere in the 56,500 or 600 range will be the numbers that DHEC will report today. We're doing quite a bit of testing throughout the state. Both the public and the private sector are doing testing, which has been in great part why we've seen the numbers grow up as we have. But in many of these people who are tested are non-symptomatic. They may not have had any idea that they were positive with COVID. They went to a testing site and they were found to be positive. And it's a good thing in that as more of the public is exposed to the virus, and maybe exposed in a way that doesn't require them to have a lot of healthcare needs, that will help overall the population to be a little bit more resistant. And that is part of the strategy as we move forward until we're able to develop a vaccine and maybe a possible treatment for COVID. So a community, I guess, exposure, but in a controlled manner so that we don't overburden our healthcare system. Whether it's a part of the plan, it is certainly a strategy now that we're going to have to see play out, allow us to work through this process. And in the testing arena right now, we have a little over 500 soldiers from the South Carolina National Guard and a few of our airmen that are called up on duty to support, again, primarily DHEC in that mission. We are actively each and every day going out with DHEC to testing sites across the state. A lot of these are in rural areas of the state where we will set up tents and other portable testing type devices where the public is simply able to pull up in their vehicle, never having to exit their vehicle, drive through a tent type configuration and to be tested, and then shortly after that get the results from those tests. As we are able to test more people, that is one of the requirements that many of our employers throughout the state have said. We have to have a test of our employees before we're going to be willing and able to bring them back to work. So that helps in that strategy and being able to develop and bring our economy back online. One of the challenges that we see in bringing the economy back online, though, is bringing our healthcare system and our daycare systems back online. And it's kind of odd there when you talk about daycare and the importance that it has on the economy. But as with sure many of you and many of our soldiers and our airmen, they are dependent upon daycare to provide care for their children. So that has been a challenge for us as we've tried to bring our workforce back, is how do we arrange to ensure that our soldiers and airmen have adequate daycare for their children. So that strategy is a holistic approach to it. We're all trying to work together to ensure that we have the capacity to bring the workforce back together and helping the state again stand back up. Another mission that we're currently supporting, we're supporting the South Carolina Department of Corrections. We're working in at least 4 facilities now, and I won't name those facilities, but where they have had outbreaks of COVID among the prison population. We've been there to help provide basic medical support to their already existing medical staff. We also have some capacity to help sanitize facilities, which we are doing that along with other facilities that are open to either, excuse me, to the public or vital to the overall needs of the state. So as we continue to offer our capabilities, we see that demand continuing to grow. Currently, the soldiers that are on our mission are being paid through a federal order status. Makes no difference to the average individual, but it does to the soldier. Instead of being on state active duty, which our soldiers are normally when they're in response to a hurricane type environment, they're on a federal order that provides them with more protection than what a state active duty order would normally provide to them. Doesn't change our ability to perform the mission, doesn't change any of our authorities, but it's another example of how we have been flexible enough here as an organization to get at complex needs and find creative solutions. Normally we would not use that authority, but when we recognize the unique threats that maybe the COVID environment would bring to our soldiers, airmen, and employees, we had to find solutions to help get at how we could best protect them. We've also supported our food banks around the state. We're not as actively engaged in that today, but I would anticipate that as we see more demand on our food banks, which we are seeing on a regular basis now throughout the state, that particular need may be something that we'll see here in the near future also. One of the unique missions that we had to perform and recently completed, I think everybody may be following that when schools were let out, there was still a requirement to feed students that were on reduced or the free lunch programs that are mandated by the state and federal governments. So the Department of Education had to find a way to do 2 things: carry mobile education to students at home and to find a way to feed that. And they came up with a very creative plan where buses were sent out throughout the state, carrying portable Wi-Fi capability out to students that did not have Wi-Fi capability in their home or the correct bandwidth to be able to reach and do work online. Plus we had to deliver meals. Some of these schools experienced problems with COVID sickness with bus drivers. We activated an additional about 50 soldiers, and many of them had already the training to be able to drive a bus, but we had to do training, and we had about 50 soldiers supporting one of the school districts on the coastal part of the state for well over a month, driving buses, delivering meals. Again, how we get through events such as this tell us who we are as a society, who we are as a nation. And we had one particular soldier that was recognized here just recently by the NASCAR event. Had one of our NASCAR drivers who had once been in the National Guard himself, recognized a soldier. While he was out on his bus route, he noticed that many of the young children did not have all the school supplies and things that they needed. He took it upon himself to raise money, to buy books, and to buy school supplies. So when he would deliver meals to the school or to the children, he would also hand them a book and some school supplies. Small contribution, but the kind of contribution that I think helps separate Americans from many others around the world. He had a job, but he also had a heart, and he found a way to help individuals. And you never know what little things will make a difference in someone's life going forward. What I say that is that a lot of times people see a soldier, or they see a public safety officer, and they see them in one particular light. But I would like to submit that our soldiers, our airmen, are just common citizens like you. We go to church with you, we work with you, we work for you, and we live in our communities. And we want our communities not just to survive an event like COVID, but we want us to thrive. And so when our soldiers go out each and every day, I encourage them to go out with a smile on their face, with words of encouragement, and being willing to help those out that may be in need. And through that, we'll get through this one day at a time. As we, again, look to be able to respond to the needs of the organization or the state, our staff each and every day meets with representatives of the various state agencies that we support. We were meeting with the governor's staff on a daily basis. We now have a little less robust schedule for meeting. As again, in the private sector, I'm sure you understand that you can meet a little bit more than maybe necessary. And when you're meeting, you're not working. And when you're not working, you're not being productive. But here, we have been working at this for so long now, the needs to meet on as robust of a basis as we were aren't quite there. But we're still meeting. We're still looking at the challenges that this great state faces. And as we look to bring back our economy and do so in a manner that we're taking care of our citizens, is something that we all strive to be able to be a part of. Again, as I noted earlier, we're still currently supporting the war fight. We were fortunate here over the last several weeks to bring a couple of our units back that had been deployed. Due to challenges that we had with COVID around the world, some of those soldiers were delayed in returning back to their families and to their loved ones, but we were successful in getting some of them back here just recently. The largest unit that we have deployed right now is the 4th of the 118th Infantry Battalion, headquartered in Union, South Carolina. We are starting to get some of those soldiers back now, and it is heartwarming to see those reunions take place. And unlike most deployments that we have, when a soldier is deployed, they reasonably know that their families are home, safe, and protected. However, when we started dealing with the COVID environment, our family members are always worried about our soldiers and airmen who are deployed. But now, in the environment we're in, those same soldiers and airmen who are deployed worry about the safety of their families here at home due to COVID. And unfortunately, some have lost family members while deployed, and we're not able to get back to be a part of and in support of their families and loved ones while they're deployed. A challenge that we all face as servicemen and women, and it's a challenge that comes with the territory, but it doesn't necessarily make it any easier for our people. One other unique challenge that we had during the COVID response, which again we're currently part of, I think everyone is tracking the civil protest and social unrest that we've had in the nation, and I won't comment much on that, but to say that as members of the National Guard, it goes back again to our unique authority to be able to support missions that our active counterpart could not support without some significant utilizations of authorities on the federal level. But we had around 500 soldiers who were deployed on orders to come on and support the civil unrest here in South Carolina. And as our soldiers and airmen were told, we're not deployed to police, we're deployed to protect our citizens. These are citizens that we live and work with. And for those who are exercising their constitutional right to protest, that is why we're on the street, to ensure that they're able to safely exercise their constitutional rights to peacefully protest. And that was what our soldiers and what our airmen were deployed to be able to do. They did that quite well. They primarily served in the Charleston area. We had some here in Columbia, but they were never needed to respond to any of the missions or needs here in Columbia. In addition, though, we deployed about 450 to our nation's capital to help provide security to infrastructure there and national monuments. And again, their mission was to protect, not to police. Our soldiers did an outstanding job there. And I just want to say that I am extremely proud of how well they honored their commitment, where many of them may have been professionally and personally somewhat unsure of were they doing the right thing. But they did what they were asked to do, and they did it under very trying and difficult conditions. And these are a lot of very young soldiers. I had an opportunity before they left the Charleston area, and these are young soldiers, 18, 19, 20 years of age. Some of them probably the first time heading to their nation's capital. They had a look of concern. They had been watching the news, but again, they answered the call of this nation, as they have done over the last decade and a half in support of the war fight. You can be proud of the young men and young women who served in the South Carolina National Guard and call Lexington home, as many of you do. We get great support out of the Lexington community. Our units that are in the Columbia area recruit great soldiers out of the high schools there in the Lexington area, Lexington, White Knoll, River Bluff, Pillion, Gilbert, and they do wonderful things in service to this great state and this great nation. I've had the honor of seeing many of them leave on deployments, and many of them come back, and the tears of concern as they go out are tears of happiness and joy when we see those soldiers return back. As members of our community, we always thank those that offer, and I know generously, many do offer discounts to our military, and I want to tell you a thank you for you doing that when you, but more importantly than that, that simple thank you for what you do is really a price that most of them are very happy to get in terms of appreciation. I want to pause now and just see if there are any questions that you may have as it relates to your National Guard and what we're doing today and what we may be doing tomorrow in our local communities. Again, we are in hurricane season now, so we are preparing each and every day to be able to respond to the state's and the nation's needs in a hurricane environment, along during the time that we're in a COVID environment. And that in itself is proving some challenges. But again, facing challenges is what we're all about. So pause now for any questions.
Mr. Major General.
Yes, sir.
My name's Casey. I was kind of curious, like you're talking about like kind of like the whole social aspect of it too, like the ground thing. Like there's no argument there, you know. Putting in the work every day. Commercial fisherman for 20 years, so I'm not military, but understand the hard work. How is everybody holding up mentally? Like how, like the kind of the social stability side of it. Like, is there like I know military is unifying anyways. But how is the reaction? How are our National Guard troops, things like that? Like how are they doing out in the field, sir?
I appreciate that. That is a great question. The military, by its definition, has built-in capacities to ensure our soldiers' well-being, resiliency, and able to deal with issues that you may face on the battlefield, that you may face in other environments. We have our chaplains that are embedded in our units. We have our, excuse me, our NCO Corps, and one of the primary missions that our state command sergeant major has is ensuring the health and welfare of our soldiers and airmen. However, our previous Adjutant General, Major General Bob Livingston, many of you may know, runs Gregory Electric here in the Columbia area. When he came into office, we had just returned back from a deployment to Afghanistan. He saw the need, as you described there, and recognized that we did not have all of the capacity to deal with that. stood up an organization within our program or within our Guard. We call it our Service Member Family Care Program. There we have behavioral health specialists that work with our soldiers. And we take it from a holistic standpoint. We have dietitians that can help soldiers get on a proper diet and exercise program. The healthier you are is data to show the more resilient you are to deal with stress. We have a very aggressive jobs placement program that is intended to either help Guardsmen get a job or get a better job. And one of the things that we see when soldiers return back from deployments, many of them either by the fact that their jobs may have gone away or that they feel like they need to move on in a different direction, they look to find different employment. And one thing that we do find across the board, that the more stable the soldiers' job situation is, the better they're able to provide for the families, the better they're able to cope with the stresses that they see each and every day. Unique to the situation now is that while we work every day to ensure the safety of our soldiers while they're on mission, providing them with the proper PPE, personal protection equipment, we check in their temperatures, we're doing everything there. When they're away from home, they're concerned about the health and welfare of their family members. So we are aggressively getting at that when we have a soldier or an airman that displays any symptoms COVID related. We quarantine them away from the rest of the force in an effort to safeguard the force. But our chaplains, our behavioral health personnel, and all our leadership is actively each and every day engaged with this. And it is, again, one of the top priorities that the Secretary of Defense gave, and it is the priority that I have, is taking care of the force.
Well, thank you so much for your service, sir. And, thank you. Thank you so much.
Thank you, sir.
Major General, good morning.
Good morning.
I'm Regina Brown with Prisma Health. First of all,
Yes, ma'am.
thank you for your service, but I just want to personally thank you for allowing the soldiers to staff our COVID sites. They have been a tremendous help with us keeping the flow of things and making sure that we can get folks through the testing in a timely manner. And so I know it's a great sacrifice for them, but I just want to say thank you for allowing them to assist Prisma Health in this worthy community endeavor.
Well, thank you. And I would like to thank all with Prisma. Y'all have been very accommodating to our needs, been very accommodating in terms of helping us work through some, again, complex issues that we have. We have partnered and worked well with the South Carolina Hospital Association, Mr. Thornton Kirby there. Mr. Kirby and I knew each other growing up in the Irmo area, and his dad was an instructor out at the South Carolina Criminal Justice Academy. But getting to know Thornton again and work with Thornton along with the other hospitals, leadership across the state has been a joy. And to see the level of commitment that our healthcare providers have given to this has been outstanding. And just recently, in recognition to our healthcare and first responders, we had a flyover of many of our hospitals around the state with our F-16s that are stationed out at McEntire Army Air National Guard Base. Small token of our appreciation from the Department of Defense, but we have been the recipient of a lot of public thanks and gratitude for our service over the last decade and a half. And now it's time for us to be able to tip our hat back to those that are on the front end of the fight now, and that's our public health workers, our first responders, and those, many of which are employees of Prisma. So thank you.
Thank you. And I tell you, that flyover was awesome.
Well, we were glad to do it. Our pilots love to do that. It's our Air Force pilots, you can say they have a little bit of an ego, but that would be very much a small understatement. They love to fly.
Thank you.
Thank you.
One question that I was going to ask, Major General, was I know you talked about adjustment. So beginning with this whole COVID environment, what is one of the tasks that the National Guard kind of had that maybe at the beginning was a major adjustment, but now you've kind of definitely grown accustomed to doing?
We have within our organization a medical capability. Each of our units has medical personnel that are assigned, and it's generally, though, tailored to support our tactical mission, the combat type mission. We have combat lifesavers, and a combat lifesaver could be someone like myself, which I was deployed to both Afghanistan and Iraq, where I'm given just enough medical training to help provide immediate life-saving capabilities to a soldier on the battlefield. And then we have our medics, who are basically in the civilian world would be the equivalent of an EMT. And then we have nurses and doctors that work in our organization. But that capability was just basically narrowly defined to support our battlefield mission. A challenge that we had to do, though, was work with DHEC and the Labor Licensing and Regulations, LLR, to help take those military certifications and allow us to use them in support of citizens and the public. Our medics on a day-to-day basis can provide health care of different levels to a soldier, and they're fully cleared and capable to do so. But to provide that same level of care to a civilian, there are restrictions that, and we have been working through that process and have had great success in working through some of those challenges. It took the governor, in many cases, having to ease regulations that both DHEC and LLR have that they work with. But I think it's, again, looking at the situations that we have, and it's not always the senior leaders, and you probably recognize this in the private sector. It is your employees that work day to day doing the task of your company. And for us, it was our soldiers and the airmen that were down doing the task that recognized the unique challenges that we had and came up with creative solutions. But getting at the ability to leverage our healthcare workers within the Guard to be able to support those missions like with Prisma and elsewhere was an early on challenge that we have seen success, but we're working to continue to grow that capacity. Unfortunately, again, I don't know when we will see the current COVID environment change that we can call it getting back to normal. I think we're in it for an extended period of time. So we're poised and setting ourselves up for what may be the next round of the COVID fight, and making sure that we're adequately prepared to meet those challenges.
Thank you. Anybody have any more final thoughts or questions for the Major General before we conclude the meeting?
Van, Odie, just thank you for being with us this morning. Appreciate all y'all do, and keep the faith. We'll get over this thing before too awfully long.
Thank you, Odie, and again to all of you. Thank you for providing support to the Lexington community by your involvement with the Chamber, by coming together collectively. Y'all represent the Lexington community in a very positive way. Again, I'm proud to call myself a resident of Lexington, and look to see Lexington continue to grow in a responsible way as we move forward. So thank you for allowing me the opportunity to come on this morning to share a little bit about your National Guard. Thank you.